Hello, everyone. Hello, everyone. If I could have your attention up here, please. If I could have your attention. Hello, everyone. My name is Bruce Sellery, and I am the president of the Canadian Club of Toronto. Thank you again so much for joining us today. First, I'd like to acknowledge today's event sponsors. Canada Life, represented by Ali Giassi. MSKESSON Canada, represented by Dimitri Polygenis. MORNEAU SHEPELL, represented by Nigel Branker. And TD, represented by Naki Osute. We appreciate your support. Round of applause for our sponsors. Thank you. I would also like to thank Simon Dwyer from Bell Canada, who has sponsored the participation of the youth and young leaders joining us this afternoon from the Ryerson Leadership Lab. Where are you, Ryerson students? You're somewhere? Yes! There's a nice hello there. Excellent. This is obviously a very, very busy time for the Health Ministry, and so we are grateful that the Minister was still able to join us today. Our club does not shy away from addressing sensitive and controversial topics. In this province, more than 1 million people experience a mental health or addiction issue every year, every single year, which is a very, very difficult figure to comprehend. These are often complex cases that require a well-coordinated team to address the issues and to provide effective care. However, the system designed to provide support for mental health and addiction is not optimal. The Health Ministry recognizes this and is taking action, and we are pleased that the Health Minister, the Honourable Christine Elliott, is here to share her plans to build a comprehensive mental health and addiction system. Minister Elliott is well qualified to lead this effort. In 2016, she became Ontario's first patient ombudsman, where she fought for better access to health care for all. Her lens as a lawyer, businesswoman, politician, entrepreneur, and parent is helpful in developing responsive services for the people who need them and the professionals who deliver care. Minister Elliott has a proven track record of bringing people together to build stronger and more inclusive communities. Her pro bono legal work for charitable organizations has been recognized by Rotary International. She also co-founded the Abilities Centre in Whitby, Ontario. The centre celebrates people of all abilities and was a key community hub for the 2015 Para-Pan Am Games. Right now, her focus is on ending hallway healthcare and on providing residents the services they need when and where they need them. The Minister will deliver a brief speech and then be joined on stage for a conversation with Jane Tabor, Vice President, Public Affairs for National Public Relations. Jane is a former political journalist with the Globe and Mail and was the co-host of CTV's Question Period. She spent more than 25 years covering Parliament Hill and Queen's Park. She joined National Public Relations in August 2016. Minister Elliott, the Canadian Club podium is now yours. I'm ready. Here we go. Nice.
Well, thank you very much, Bruce, for your very kind introduction, and good afternoon, everyone. Before I begin, please allow me the opportunity to thank Canadian Club Toronto and the generous sponsors for making today possible. And thanks to all of you for taking time out of your busy schedules to join us. I very, very much appreciate it. Even my son actually came today, so this must be a big day, so thank you. I'd also like to acknowledge Michael Tibolo, Ontario's Associate Minister of Mental Health and Addictions, for being here, as well as Robin Martin, the MPP for Eglinton Lawrence, who is the Parliamentary Assistant in Health. Thank you. And Mr. Matt Anderson as well, the President and Chief Executive Officer at Ontario Health. Thank you all for your continued partnership and support. Now, each of us here today has our own personal experience with mental health and addictions, whether it's our own challenges or those of a loved one. Someone close to me struggled for many years with their mental health, much of it in isolation. As a result, they lost their job, and they even struggled to maintain custody of their children. At one point, knowing that things weren't going very well, I reached out to ask them how they were doing. What they said has stuck with me ever since. My problems with mental health have shattered all my hopes and dreams. All my hopes and dreams. I've carried those words with me in my work as Minister of Health. Over the course of more than a year, Associate Minister Tivolo, Parliamentary Assistant Robin Martin, and I have traveled across the province listening to Ontarians as they told us about what they expected to see in our mental health and addiction system. Each of the stories we heard is rooted in deeply personal experiences with a mental health and addictions issue and the struggles Ontarians grapple with in trying to find help and support. Children and their parents worried about young Ontarians turning 19 and losing support in a system that for too long has failed to transition patients as they enter adulthood. Police officers lacking the tools they need to effectively manage sensitive situations in their communities. And Ontarians of all ages feeling unsupported and alone as they often struggle in silence with anxiety or depression. Of course, the reality is that they are not alone. Every year, over 1 million Ontarians struggle with a mental health or addictions issue, leading to serious impacts on a person's quality of life, their ability to go to school, to make a living, or to raise a family. These stories and so many others were born from extensive consultations with grassroots organizations, frontline service provider organizations, families, and of course, most importantly, people with lived experience. We have listened, and we've heard about the many challenges facing Ontario's mental health and addiction system. Long wait times, minimal understanding of what services are available and where to find them, uneven service quality between providers and regions, fragmentation and poor coordination, scant availability of appropriate housing, lack of evidence-based funding, and an absence of data limiting effective oversight and accountability. Sadly, these problems aren't new. In fact, my own experience listening to families over the past 2 decades have traced the arc of a system that, despite the very best efforts of our tremendous frontline professionals, has failed to meaningfully connect people with comprehensive care in their communities. Volunteering on the board of directors at Durham Mental Health Services, I saw firsthand gaps in service that forced patients to wait on wait lists. In 2009, I co-chaired an all-party select committee on mental health and addictions. During that time, we listened to over 230 people and received over 300 submissions. These stories led to 23 recommendations, including the creation of a central engine to design, manage, and coordinate the system. Later, as the province's first patient ombudsman, Ontarians shared with me their experience of feeling lost in a system defined by its complexity. Thinking that there was nowhere else to go, they turned to overcrowded hospital emergency departments for help, only after, in many cases, reaching a crisis point. Now, I'm hearing similar stories, rooted in common challenges. Indeed, while they span decades, each of these experiences and the stories shared along the way make clear Ontarians' persistent struggles with our mental health and addiction system. All told, there is a clear and pressing case for action. So it did give me great pleasure this week to launch Roadmap to Wellness, a plan to build Ontario's mental health and addiction system. And I couldn't be happier to be here today to share with you some of the details of this bold new plan. As the name implies, Roadmap to Wellness provides a path to building a comprehensive and connected mental health and addiction system that offers Ontarians better access to high-quality care when and where they need it. And it reflects the priorities we heard again and again through our conversation with patients and frontline providers. Roadmap to Wellness is a plan built around 4 pillars. First, enhancing the quality of services across Ontario. Second, expanding existing mental health and addiction services by investing in priority areas like wait times. Third, implementing innovative solutions to fill gaps in care. And fourth, making access to services more improved by making the system navigation easier for patients and families. Right now, it's too hard for people to find their way through the system. In some cases, they just end up looking for care. Underpinning all of these pillars is the new Mental Health and Addictions Centre of Excellence within Ontario Health. Nearly a decade after it was first recommended by the Select Committee on Mental Health and Addictions, the centre will serve as the foundation upon which the plan will be built and will be responsible for its successful implementation. It will establish a single point of accountability and oversight, while also doing the hard work of standardizing and monitoring the quality and delivery of evidence-based services. It will, for the first time in Ontario's history, drive the broad and systemic transformation we need to see in order to fully understand these gaps in care and, in turn, finally develop a comprehensive and connected system of high-quality care. To do so, the centre will work with people with lived experience, service providers, clinicians, and researchers to finally formalize a core services framework. This framework will identify and define the core services that will, over time, be made available to all Ontarians. It will also guide future funding decisions rooted in evidence for years to come. The result will be a future in which every Ontarian, regardless of where they call home, whether it's here in the Greater Toronto Area or in the far north of Ontario, everyone will have equitable access to high-quality mental health and addiction services. Because we know that mental health and addictions challenges are varied and complex, they will not easily be solved. But the Mental Health and Addictions Centre of Excellence is truly a game changer. Historically, Ontario has had great success when we work together to break down barriers and build world-class systems of care. And indeed, we need only look to the success story of cancer care. Ontario's cancer care system has become the envy of the world, and we are fully committed to applying the same lessons learned there to enable the same transformation for mental health and addictions. As the Centre of Excellence does its work, it will also provide support and services to Ontario health teams as they better connect patients to the care they need. While critically important, this work will take time. As the centre drives long overdue improvements and develops the core services framework, we know that we also need to continue to invest in expanding existing services while also filling urgent gaps in care. In doing so, we can begin to address the significant and debilitating wait times that currently exist in our system. One of the ways we are demonstrating our commitment to action is by launching Mindability, a first-of-its-kind program in Canada providing cognitive behavioral therapy to equip Ontarians with lifelong skills to manage their mental health and overall well-being. Cognitive behavioral therapy is widely recognized as an effective way to manage anxiety and depression, the two most common mental health challenges faced by people in Ontario. Launching in spring 2020, Mindability will be funded just like OHIP with no out-of-pocket costs for patients. Through this groundbreaking program, an individual will receive an assessment from a trained mental health clinician and be offered a therapy program that best meets their individual needs. For some, This may include internet-based modules or personal workbooks with telephone coaching. For others, clinical counseling or face-to-face group or individual therapy will be best, because we do know that no one patient is the same. The long-haul truck driver feeling isolated from friends and family. The middle-aged professional struggling with work performance. Or the grade 11 student increasingly finding that her classes are slipping. Each of these individuals has unique needs. But by matching them with the most appropriate support, Mindability will make a real difference in their lives. This is just one of the ways that Roadmap to Wellness will improve the availability and quality of community-based mental health and addiction supports, better connect Ontarians with these services, and alleviate growing pressures on our hospitals, supporting our additional goal of ending hallway healthcare. At maturity, Mindability will provide the cognitive behavioral therapy to 80,000 clients. That's 80,000 Ontarians receiving early intervention treatment, supported on a path to wellness, avoiding a future limited to crisis and the revolving door of an emergency department. With the introduction of Roadmap to Wellness, Ontario is finally turning a corner. We are laying out a real path towards meaningful improvements to the care that Ontarians receive. To enable this new plan, our government is investing $3.8 billion over 10 years to expand services in communities across the province. This year, our government increased funding for mental health and addiction services by $174 million, with these important investments growing in the years to come. That's because we are investing in building a comprehensive and connected mental health and addiction system. Creating this system, one that all Ontarians can rely on, will take time. But as we continue with this hard work, we will engage with our partners who deliver mental health and addiction services to ensure that all Ontarians and their families are properly supported throughout their mental health or addictions journey. This work must and will include continued engagement with our Indigenous partners to co-create programs and services that meet the unique needs of their communities. Working together, we will build a mental health and addiction system that truly meets the needs of all Ontarians. A system that restores hope and inspires dreams, not only for my friend, but for yours as well. So thank you very much. And I believe Jane and I are going to continue our conversation.
Well, thank you very much, Minister. And you can see by the number of questions that I have received so far that you have a very engaged audience. And so you've done a lot of my work for me. So thank you very much. And hopefully we'll get to some of those questions. Just to start out, you mentioned $3.8 billion. That's a lot of money.
It is.
Let's break that down. That's our money. That's taxpayers' money. Are we going to see that in the budget? What kind of allocation are we going to see for your new strategy in the budget?
Well, I can't reveal any details of the budget
I knew she
right
was
now.
gonna
That's
say
going to be
that,
up to
yes.
Minister Phillips to do that on March 25th. But people can expect that there will be another substantial investment.
And when we say substantial investment, like let's get some framework around that. Hundreds of millions of dollars, $200,000. Like what do you expect us to see?
I would say more on the former side. Yes.
More
yes,
on the former
yes.
side.
Not
Okay.
200,000. I don't think that would do too well to initiate the
A 10-year
roadmap.
program, so
Yes.
front loading maybe in the first few years of.
You're making this hard for me.
Well, it's about,
But
it does come down to, that's a lot of money, and it's our money, and I think people are very concerned about this, so they want to see an allocation in the upcoming budget for it.
Yes. There will be significant investments over the next number of years because we know that we are taking a cross-government approach to this. This isn't just about money coming into the Ministry of Health. This is also the Ministry of the Attorney General. There are many people with chronic mental health and addictions issues that unnecessarily get caught up in legal issues. We want to make sure that we have trained personnel, that we can have mental health workers go out with police officers. That is really helping a lot to both cut down on the number of people that get caught up in the law where they don't need to be, and making sure that they actually get the services that they need. We're looking at housing as well. We know that housing is a big concern, so we're working with the Minister of Municipal Affairs and Housing, the Solicitor General as well. It cuts across almost every ministry in government. So $3.8 billion is a lot of money, but when you break it down across all those ministries, it means you have to make very careful choices.
Okay, and you talk also about hallway healthcare and waiting times, and we hear a lot about that from your government. What will this do to reduce wait times? Can you give us a framework again on what we're going to see?
What we're trying to do with this is to build up more community supports so that people don't end up as a default going into a hospital emergency department when they're in crisis. That's what happens time and time again, and I think probably the CEOs of every hospital that's here, they probably will have a group of patients that come in regularly to the emergency department because they're having a mental health crisis. We want people to be able to get help sooner in their communities so that they can be well, not have to go to the emergency department, because it's not good for hospitals, obviously, but it's not good for them either. They don't always get the care that they need there. So we want to have more community-based support so that people can go there and receive the services that they need without going to a hospital.
And you've based this on Cancer Care Ontario. You looked at that.
Yes.
You looked at that framework as well, and wait times have been reduced as a result of Cancer Care Ontario. So are you expecting that same kind of result?
Yes, that's one of the ways that we can reduce hallway healthcare. There's no easy solution to that, but it certainly can help. But I think mostly in this situation, make sure that the people that really need help can get help, because we heard so many stories from parents who are distraught that they have been told that their son or daughter has to wait for 2 years to receive mental health counseling. When you have a suicidal child, you can't accept that answer. I wouldn't either. And so we need to do better, and Mindability will certainly help with that.
Yeah, I want to ask you, first of all, before we get into Mindability, because that is the centerpiece, it seems, of your strategy. You spent a year going across the province, talking to people, consulting for this strategy. What surprised you the most? What did you walk away with sort of your aha?
I would say the fact that with every consultation that we went into, the biggest issue that was pointed off right off the top was lack of supportive housing. That it's not realistic. People told us to expect someone particularly recovering from addiction that might go into rehabilitation, to expect them to be able to recover if they're couch surfing or if they're living in a shelter. So that came up. I wasn't necessarily expecting that. I knew it was a problem, but it was noted as a big problem in every community we went to.
Right, and so was there one person that you talked to, you started off your speech speaking about personally, about a friend of yours. Was there anybody else that you met along the way that convinced you to put something in your strategy that really informed what you presented earlier this week?
I think just listening to the parents, primarily, who are becoming increasingly desperate for services for their son or daughter. That had a huge impact on me as a parent, as a politician, knowing that they really need help right away. I think on the addiction side, I also had the opportunity to meet with several people who are visiting the consumption and treatment services supports that we have, that are still taking whatever substance they're on, but they told me how they really don't trust hospitals, they don't trust healthcare professionals, they feel that they are the lowest of the low, and that nobody even feels that it's worthwhile speaking with them. That made a huge impression on me and told me that we need to do more to help them get into rehab services if they're ready to do so, and that we don't have the services that we need right now.
Okay, one of the questions that we received from the audience was about students. So how would students, and that gets into your centerpiece program, how would students access that? How would that work?
Well, students would be able to access the Mindability program by calling. We're going to issue one central number that anyone can call. They can then be assessed by a trained mental health clinician, and then they will establish a treatment program for them that works for them. So for a student, it might be something, a module. They might work through a workbook. But if the clinician feels that as a result of working through that program, there's still a need for service, they will escalate the service and bring the person in, make sure that they are able to get the one-on-one counseling that they need.
Are there enough counselors and enough professionals in Ontario to be able to deal with all of this? You know, this is something that is coming on stream fairly quickly.
Yes.
Do we have the resources to deal with this?
Yes, we do right now. People will have to be trained specifically on this program, but I don't think for most trained clinicians this will be anything different, really, than the work that they already do. But we also will be expanding it in the fall and next year. So I think for any students that might be in the room that are looking for something to get into, this would be a very good career.
Okay, all right. So as you say, it is a sort of a pan-government initiative as well. And so talk a little bit about Mindability. How did you discover that? How did that come about? I know it's a program that's used in the UK, so
Yes.
Talk about that a little bit.
Well, it really was the UK experience that really led us to Mindability. The situation there was a little bit different because in that situation, government had to be convinced that putting money into these kinds of programs was a good idea and then develop the program. Here, we had already made the commitment to invest the money, so it was what's going to be the best program, and knowing that anxiety and depression, at least at a low level, are areas that can be treated very successfully with cognitive behavioral therapy. It just made sense for us if we wanted to scale up very quickly to be able to offer that. And we know that price is a big concern for people, that there's a long wait list, largely because people are waiting to see a psychiatrist, which is funded through OHIP. But if you don't want to wait that long, it's about $250 an hour for a private therapist, which is beyond the ability of most families to pay. So this just seemed like an obvious solution to helping young people get the supports and services that they need.
Okay, so again, tons of questions coming here. So let me talk about some of the people that maybe have been left behind from your strategy, speaking in particularly about police officers. There is a lot about first responders in the strategy, but not for them personally. And why did you decide not to give them any support with PTSD or dealing with some of the mental health issues that they have from just what they do on their job?
We actually will be expanding supports for PTSD for first responders, for firefighters, for police officers, often for people who work in jails as well, because they're often working with individuals,
right.
Residents, that have mental health and addictions challenges too. So we want to make sure that everybody gets the level of support that they need.
Okay, so that's something that's going to be coming in the next month?
Yes, as we
2
roll out
months?
the plan. The plan is
Yeah.
going to take some time to roll out. We want to get Mindability underway directly because that is going to be an immediate impact for people and start lowering the wait lists that are unacceptably high right now.
All right. And what about seniors? There is issues around seniors and isolation and where they can live and affordability, that kind of thing. But what about seniors and mental health? I mean, is that something that's concerning? Because I didn't see a lot of that or anything in your strategy.
Well, we do know that there are many seniors with that do have mental health challenges, some of which are incorrectly diagnosed as Alzheimer's or dementia.
Yeah.
So I think we need to make sure that seniors that have mental health issues can receive assistance for those challenges, Mindability would be a way that they could achieve that assistance.
Okay, so I got a question here about Mindability. It says, your questioner asks, Mindability will be a provincial program. What is the anticipated relationships with more local resources, including Schedule I hospitals in OHIP?
Well, it will be funded under OHIP. With hospitals, our hope is that people won't need to go to hospitals if they're on the Mindability program, because our hope is that they won't get into a crisis that requires them to attend at a hospital.
Right.
But we're also wanting to make sure that we work the program into the work that's being done by the local Ontario health teams as well, because they will be responsible for delivering both physical health care and mental health care. They both have to go hand in hand, and we know that there's no health without mental health. It's absolutely true. And so the local teams, many of the first 24 teams that have already been established, have mental health as one of their top priorities to deal with that in their communities.
Okay. Yeah, I noticed that throughout the strategy that you talked about, there's no mental health without health, there's no health without mental health. Do you still feel there's a stigma around this, and this is something that this strategy is addressing as well?
There still is stigma. It's not as bad, I don't think, as it used to be, but it is still out there. I know it prevents a number of people who are working, for example, maybe to get help to speak with their employer about it. They feel that they'll be held back, that there's going to be a judgment made about them. I think that the launch of Mindability will really help, because this is going to be a widespread program that's going to be available to anybody, and you can do it in your own home, on your own time, that you don't have to discuss it with people. You can do it more privately if that's the way you wish to do it.
Okay, so we have limited time, and so I want to ask you, if we are in this audience to take one thing away from this strategy, one thing you really want us to know and Ontarians to know, what would it be?
That this is a plan that is going to make a real improvement in the lives of Ontarians, not just this year, but for years to come. We finally are developing a coordinated and comprehensive plan, which we haven't had in Ontario in the past. We noted that 10 years ago. It's sad to me that, having been on the Select Committee 10 years ago, we're dealing with it now. But we are dealing with it, and this is going to connect the pieces and greatly improve our system to allow everybody who needs care to get that care.
Okay, and one last question. I've got the Minister of Health with me here, and of course, coronavirus is top of mind to everyone, so I want to know, how prepared are we here in Ontario for an outbreak, a community outbreak? What are you expecting? I'm a bit of a hypochondriac, so I'm concerned about it, and I imagine a lot of other people are too.
Well, we are very prepared. Right now, we're dealing with the containment stage, and we've been very fortunate that the people who have been identified with coronavirus right now, I think we have 22 people in Ontario, 4 of whom are now completely resolved. But should the situation change, should we see a community spread, which we haven't seen thus far, or should we see a vast number of people coming back into the country from other places with coronavirus, we have a plan and a team in place to deal with it. There's a call every day. There are meetings that are happening now. We have a command table and a table for everything you can imagine to deal with it, so that if it goes from 0 to 22 to 1,000, we will be able to manage it. Hospitals are doing a great job coordinating. Health professionals are doing a great job. We want to make sure that our health professionals are aware of the appropriate personal protective gear, which they're doing. It's very important, and we learned that from SARS. We need to keep our health professionals safe, and we need to make sure that we treat everybody who may present with coronavirus. But the system is working. We developed a system, not we, because I wasn't here then, but a system was developed after SARS 17 years ago. We have learned some significant lessons from that. Protocols were set in place a number of years ago, and now we are just putting the system into use. The system is working, and the risk to Ontarians remains very low.
All right, thank you very much. Ladies and gentlemen, Minister of Health, Christine
Thank you.
Elliott. Thank you.
Thank you very much.
Thank you. You can stay seated. Thank you very much. Well, this is a sold-out room, so clearly this is a topic that has a great deal of resonance for people, and I will say that is the most questions I have ever seen for any event in Canadian Club history in my knowledge. Anyway, so clearly engagement. Jane, thank you for joining us for the conversation and for the reassurance that your journalistic chops are still strong. The instinct is there. Minister Elliott, on behalf of the Canadian Club of Toronto, thank you so much for sharing your plan, and also thank you for making this personal, because it really is personal for a lot of people. Thank you. One final note, in the days before we head into the celebration of International Women's Day, I think it is very important to acknowledge how incredibly important it is to have senior women in leadership roles across this country. And in particular, Minister Elliott, thank you for leading by example with your wisdom and determination. Thank you very much. One final thank you before we close, and that is to our sponsors. These events aren't possible without the participation of organizations who step up and support us in a financial way. Canada Life, McKesson Canada, MORNEAU, SHEPELL, and TD. And also a thank you to MediaEvents.ca, Canada's online event space, and VVC for live streaming today's event. And thank you all for making time out of your day to come and join us for this event. Live and in person, you were fearless to be here, and we appreciate that. Have a great afternoon.